Good afternoon. My name is Leslie Hines. I got the honor to interview a close friend of ours. He is a practicing Muslim. So I wrote my paper over Muslim or Islam. My client is the only son. He has a sister. Both are still present. His mother and father are still alive. His grandparents have both passed on, and he has two sons. He is dark-skinned with curly hair. Most of the male members in his family have a large gut or a large abdominal area. His sister shares the same facial features, and they both favor their mother. He carries medical, dental, and vision and lives a simple middle-class life. He has an associate's degree. He can read, write, and speak both Arabic and English, with English being his primary language that he speaks in his house. He is a hands-on and visual learner. He prefers videos and demonstrations to learn about basically anything, but medically would be the best for a return demonstration. His family shares the same views, and they use lemongrass tea when they are sick as a complementary remedy. He lives with his wife, his children, his parents, and his sister. His parents are more traditional. They are from Guyana, South America. They moved to New York when he was a child, so he has adapted a little bit of the American culture, but he still identifies primarily as Indian. His parents prefer to have examiners of the same gender. Respect is very important for their culture. He is of the Indian and the Caribbean cultures. He can, because of the modesty associated with his culture, he cannot see blood or scars, major scars. Education is very important, and his family and himself value nurses and doctors because they believe they are specialists in their field. They believe that everything happens for a reason, and that they were put on this earth for a fulfillment, and that they put their faith in Allah, that they will be kept safe as long as they follow the rules. They do not like lots of touch. It makes them uncomfortable, especially if you do not ask permission before touching them. Biocultural, his family has hypertension and diabetes that runs in the family. The brown skin and curly hair. Modest culture, so provide draping for extra privacy during examination. The typical family is the husband, the wife, children, and sometimes the sick parents live in the same house. Family and friends are their support system. The mother is the ultimate caretaker, with the father being the provider for the household. They may pray 5 times a day towards Mecca. They keep to themselves and avoid conflict. They do not show signs of affection in public because they do prefer to keep things modest and behind closed doors. The men are modest as well as the women, with women covering their arms, their shoulders, their chest, and sometimes they wear a headdress. Abortion is controversial, and they, like I said, believes the body is to be seen in public, is to not be seen in public, only in private. They believe hot foods help and cold foods hinder health. They have 2 words that they use for ill and healthy. neither of which I can pronounce, but I think it's Murad and Sahi. They often stay quiet about their pain, and prayer is very important to them. The spouse or the parent take care of the spouse if he is sick, and adult children take care of the parents when they are elderly or sick. The principal wage earner is usually the father of the household, and the mother may work depending on the rules of the household or the household in general. They value education because the more education, the better. Their religion, they do not, the client's family does not alter the body with tattoos or piercings. Prayer is done for sick patients. A sick patient may be turned towards Mecca, and they follow the Quran, and they may pray 5 times a day, and they may bring in an Islamic imam to pray on the sick or dying client's behalf. Many different dialects are spoke with Muslims depending on the country that they come from. Arabic is the most common. He gets asked often if he needs an interpreter, but he speaks English, so he always denies. Most prefer the same gender for exams, and hello, good morning, or assalamu alaikum is used as greetings. Eye contact may be okay with my client and his family as long as it's not uncomfortable staring. And he watches body language because he feels like he gets more of a sense of the person by the way their body language is versus the words they are saying. For nutrition, they have a special diet. They do not consume pork or alcohol. Their food must be halal, which means that it has to be humanely killed and no pork. And humanely means it cannot be violently killed. They have Ramadan, which is the fasting period, which means no food or liquids are consumed between sunrise and sunset. Pregnant women, children, and people who are ill or must take medicine with food are exempt. They use spices, cooking oils, and salts to cook with, and his spouse most often prepares his meal, but if he makes it home first, sometimes he will prepare the food. His food and medications must be halal, meaning no gelatins in his medication because they have pork byproducts in them. And he eats most often curry, rice, vegetables, and proper meats. So here is the board. And thank you for watching my presentation. Have a good evening.